Hello, and welcome to Breastfeeding 101 workshop. We're so happy to have you here. Today, we're going to learn some basics of breastfeeding, some benefits that breast milk has for baby and for mom, and some tips that will ensure a successful breastfeeding journey. So let's get started. What is colostrum and why is so important? The early milk your breast produces after baby is born is called colostrum. This thick, sticky breast milk is often called liquid gold, not just because of its yellow or orangey color, but because it's so important for nourishing and protecting your vulnerable newborn. Colostrum has the same ingredients that your later milk will have. It's just that the amounts of these ingredients are different, as it's tailored to your newborn's needs. For example, colostrum is sometimes referred to as a natural vaccination because its levels of antibodies and white blood cells are so high. Your first milk needs to contain these so it can protect your baby from infections and diseases after he or she leaves the safety of your womb. When will your milk come in, you may ask? This happens after 3 to 4 days of making colostrum. Your breasts will start to feel firmer. This is a sign that your milk supply is increasing and changing from colostrum to mature milk. Your milk may become whiter and creamier, but this varies between women. If your milk takes longer to come in, don't worry, this is normal and usually isn't a concern, but let your doctor know. While babies don't need more than colostrum for the first few days, the doctor may need to make sure your baby's getting enough to eat. It can help to breastfeed often during this time to stimulate your milk production. Infant health benefits. Breast milk is nature's perfect baby food. It contains immunity-boosting antibodies and healthy enzymes that scientists have yet to replicate. Here are some benefits or advantages for breast milk. Protect against allergies and eczema. It causes a less upset stomach, diarrhea, and constipation than formula. It reduces the risk of viruses, urinary tract infections, inflammatory bowel disease, gastroenteritis, ear infections, and respiratory infections. It lessens the risks of SIDS. It protects against diseases such as spinal meningitis, type 1 diabetes, and Hodgkin's lymphoma. It brings baby close to you. Here are some other health benefits. The benefits of breastfeeding don't only extend to your baby. It turns out that breastfeeding can boost your health as well. It helps to lower the risk of breast and ovarian cancer. It helps you lose pregnancy weight. It may lower your risk of osteoporosis. It heals your body after delivery. It delays menstruation. It can give you some natural birth control protection. It gives you closeness with your baby. And it saves you money. Tips for breastfeeding success. Tip number 1, keep baby in the room with you. There are many benefits to having your baby in the room with you in the hospital and at home, including that it reduces the risk of sudden infant death. It also promotes breastfeeding. Having your baby in the same room as you will help you to recognize when your baby is hungry, tired, or in need of a cuddle. It will make it easier for you to know when your baby is ready to feed. It is important to provide a safe sleep environment for your baby night and day. Tip number 2, finding the right position. Here are some breastfeeding positions. Cradle position. Cross cradle positions. Football hold. Laid back positions. Side lying. At this time, we're going to allow some minutes for you to practice some of these positions with your partner. And if you have any questions, please raise your hand. Tip number 3, feed on demand or according to need. While you are establishing your breastfeeding, your baby will feed between 7 and 12 times in 24 hours. This will settle over time. Frequent and effective feeding will help you to make enough milk for your baby. Tip number 4, don't be afraid to ask for help. The sooner you get help, the more successful you and your child's nursing relationship will be. There are multiple professional resources available to nursing mothers who are struggling to breastfeed. Tip number 5, stay well hydrated. Drinking enough water while you're breastfeeding is vitally important because nursing increases a mother's water loss. However, don't worry too much if you forgot to drink your required daily intake, because studies have shown that mild dehydration doesn't affect your breast milk. And tip number 6, breastfeeding should not be painful. Your breasts are your number one asset when you're breastfeeding. But when they're working overtime, you may hit a few roadblocks. A few common causes of breastfeeding and nipple pain include mastitis. This breast inflammation is caused by an infection that gets into the breast. It causes flu-like symptoms and red irritation around the breast. Mastitis often happens when germs from baby's mouth enter a milk duct through cracks in the nipple. You can avoid it by pumping or nursing baby to avoid engorgement. When the infection forms, breastfeeding helps to relieve it. Your doctor will also prescribe an antibiotic to clear the infection. Blocked milk ducts. If you notice a painful spot on your breast that's red and irritated, you may have a blocked duct. Keep breastfeeding so that your flow will eventually break through the blockage. Sore or cracked nipples. Just because your breasts are working extra doesn't mean that they should be sore. Lanolin cream applied after each nursing session can help you. But more importantly, adjust your breastfeeding position and make sure baby has a good latch. We're going to have some time for some questions. And thank you everybody for coming. We'll see you next.